Hello, I'm Dr. Daniel Farkas, and I'll talk to you today about mold and Candida natural solutions. Now, this disclaimer says this information is for educational purposes. Do not start, stop, or change any treatment regimen without supervision. I want to stress this. This entire area can be very confusing. There's lots of little bits of information here and there, and I would not suggest going about this on your own, no matter what your education or experience level is. So mold, Candida, thrush, all these things, they all pertain to the fungus that lives in and around us. It's on our skin, it's in our reproductive area, it's throughout our digestive tract, it's in our mouth, it's in our food, it's everywhere. It gets a real bad reputation. But the fact of the matter is that mold in itself isn't bad. It's just mold at the wrong place, wrong time, can have really bad effects on the immune system, even on behavioral health too as well. So where does it come from? Sources are environmental, like from water damaged building, black mold, very common. Workplaces too, if people happen to work in agriculture or they have on-the-job exposure from people that like remodel homes, very, very common. Understand too that in our diets, there's dietary mold that's found in all of our food, especially grains. It's all around us. Mold is everywhere. And we can get from microbiome imbalance, we can have issues with mold and bacteria balance in our intestines, on our skin, and of course in our mouth too as well. These issues are everywhere. So the ordinary approach, oftentimes if you have a surface mold, say on the skin, on the toe or like on the hairline, you can use antifungal creams, and sometimes those are effective at bringing very focused problems to resolution. But unfortunately, a lot of times what happens is the oral antifungals and random antibiotics are introduced that further disrupt things. They disrupt the things like the ordinary healthy, balanced bacteria and yeast that live in the gut. There's a time and place for antibiotics. I'm not against them, but when they're not used and used properly and followed up with, often creates lots of problems. And understand that the dietary restrictions, they can be pretty frustrating too as well. Long-term, low carbohydrate, no sugar approaches. I don't think that that's always necessary if we can get to the root cause of the problem and not have someone have to live under the cloud of ongoing dietary restrictions for years. Now, side effects of the traditional treatment, unfortunately, resistance to treatment from antifungals and antibiotics can happen that spins off into new problems. Drug reactions that cause the immune system to go completely haywire. Once, unfortunately, you start killing off bacteria and yeast, they can release toxins that unfortunately can trigger the immune system and create all new types of reactive problems. And all this just leads to is just massive frustration for the doctor, for the patient, for their family, and their support, and everybody included. Good news, though. There's a new approach that's drug-free. And to me, this is crucial that there's a time and place for antifungals, antibiotics, and more. But it's been my experience, in my opinion, that it's natural things done properly that brings things back into healthy balance versus, an antifungal or antibiotic. They just don't seem to provide for balance. I think that's very important. The new approach, it's an easier strategy, and it brings a lot of peace of mind, knowing that you're handling things holistically in a natural way that you can actually prove whether or not what you're doing is working, and I'll elaborate more. So where do you get started with all this? I always say don't guess, use a test. I can think of 2 tests that most people would probably benefit from. One is advanced stool and gut testing, unlike anything you'll find in an ordinary medical setting. This can take a deep dive look into the levels of healthy bacteria, healthy yeast, and look for overgrowth. And since that gut, many people understand and know that that is the foundation for bacteria and yeast levels all over your body. It's called the microbiome, and it needs to be assessed with a simple but powerful stool test. And then finally, the environmental and dietary exposure urine test. This is crucial. Again, it's a urine test that measures not only the exposure from the environment, from like black mold, from water damaged buildings, but also it measures yeast that comes from our diet. And some people, I would say, many are vegetarian, but even non-vegetarians, they can get exposed to lots and lots of yeast that brings up the toxic burden too high. Now they're symptomatic. This can be tested for it, and I think it needs to be. Good news, all this, it's convenient, it's accurate, and home testing is preferred. These are home tests. So this is just a little sample of the dietary environmental mold levels. This is the urine test I was just speaking of. It's interesting. Here are just 5 molds that are checked for, and the first one's pretty high. This is called ochratoxin. This is something that shows up in food. And this can be very confusing. If we don't know what these levels are, we don't know where the mold exposure is coming from, but it can all rise and it can all accumulate into a toxic level. All of these things all need to be screened. Now next, this is a very small sample of one part of the advanced stool test that shows fungal levels in the gut. And here they check for 1, 2, 3, 4, 5 different fungus and yeast that can overgrow in the gut and frankly just create a factory of obnoxious yeast and bacteria that get pumped throughout the body. This has got to be checked for, in my opinion. So here's the action steps. 1, obtain certainty through testing. Know your enemy. Don't guess, do a test. Now, number 2, use appropriate antimicrobials, and that means antifungals and antibacterials, and a binder. When you use something natural, whether it's garlic, berberine, oregano, coconut oil, that creates an opportunity for something bad to happen, unfortunately. Yes, the yeast have to be attacked, they have to be destroyed, but they are going to release toxins as they die. The appropriate binder must be used that will bind up to those toxins and make it so they can be eliminated safely and they don't make the person sicker. This happens all the time. People try antimicrobials, they guess on their own, they don't use the appropriate binder, and then they get sicker. We have to also, number 3, support the detox pathways. This is tough, especially for deep, just large infections. The poor liver and the poor kidneys, the liver especially, they have to process all of this waste and this junk out. It's very difficult for them, and they need help and support through this process. And then, of course, we have to support the gut. Healthy bacteria, healthy yeast, healthy gut lining, normal bowel movements, it's all so crucial. So when it comes to time frames, what I see typically is anywhere from 1 to 3, and I will say it's usually multiple rounds, from 1 to 3 rounds of antimicrobials done over a week's time, or sometimes even over 2 or 3 months is very common. It's all about being thorough, just like picking weeds out of a flower bed. You pick the weeds out, it looks perfect. You go back 2 or 3 weeks later, and some of them have come back. Some have come back. We want to be thorough. We want to make sure that we're using the proper antimicrobials, the proper binder, the proper gut support, and the proper immune system support while we're avoiding things like obnoxious sugars and getting the right things out of the diet. I hope you found this informative, and I just want to give you hope that if you feel that you're struggling with candida, yeast, oral thrush, wherever it is on your body, wherever it's manifested at, that I believe that there's a very advanced way that's very promising in helping people get things back to health.